We begin today with a question. How do you calculate the value of the things you do? For months, community social service providers have been telling Q&A that with government and funder purse strings tightening, they feel a growing pressure to prove their worth to keep their contracts. To do so, many are turning to consultancies to write research reports like Impact Lab, co-founded and chaired by former Prime Minister Sir Bill English. Maria English is the CEO of Impact Lab, and she is sitting beside me in the studio. Morena, Maria, it's nice to have you here. Thank you for coming in. In practical terms, what is Impact Lab? What does it do?
So Impact Lab works with charities and community organisations to connect them with information that helps them to know, show and grow the impact that they're having for the people they care about.
Be good better, do good better.
Do good better.
Do good better.
Yeah.
How do you do good better? So what are you looking for?
Yeah, so the way we think of it is when someone walks through the doors of a charity, they bring their past experiences, and often those go back many generations. And the opportunity is to shift their future life pathway in a more positive direction. So we help charities to put data and evidence behind that story of change. And we think that's important because when those positive shifts happen, the whole community is better off, and we need to know about it.
So is this a kind of oversight? Are you now...
No.
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 Because the sector kind of feels like you are, that there is now almost pressure on people to get an Impact Lab report.
Yeah. Well, I think what we're finding is if you're doing the process as a tick box exercise, you're not going to get a whole lot out of it because you tick the box and you move on. And you probably spent lots of your valuable time doing that you could have spent
valuable
on
money,
the front
right?
line.
About 30 grand for a report?
Yeah, exactly. So I think where we see charities get real value out of it is when they're approaching it with the attitude of, how can we more deeply understand the impact that we're making and also find opportunities to do even more for our communities. So what we hear, particularly from frontline, social workers and youth mentors, is often they see families at a certain point in time, but what they don't get to see is the whole arc of change that occurs for those families, especially when some of the greatest impact they're having happens years after people have left their service. Like, I'll never forget a youth worker saying to me, I work with a young person, I might help them shift the waka 10 degrees. That means in 10 years, that young person's in a totally different place. So what we do is bring in data from government and from academic evidence to help show what some of those long-term shifts look like, to give that kind of better long-term view of change to organisations so they can then share that with government and other funders.
A term you use a lot is social return on investment, SROI, right? So what do you mean by social return on investment?
Yeah, so if we think about that pathway of a person or a family, we can know from the data that's available quite often, what would someone's pathway look like without support? And then the question is, how does that shift because of the support that a charity has provided? And the difference between those two pathways is what we call social value.
And how do you know the difference?
Yeah, so we use data from the charity themselves as well as other information. So for example, we worked with a community housing provider who works with people with severe mental health conditions. And so we were able to look at data from the local former DHB, which showed that those tenants, before they got appropriate housing, were spending over 100 nights a year each in hospital. And then after they got the tailored appropriate housing that they needed, that dropped to 10 nights a year and it stayed low for the next 5 years. So we were able to calculate $4.9 million of savings in hospital capacity from that. And of course, that's just, the tip of the iceberg, right?
Yeah, sorry to interrupt. So that's the measurable stuff, right? So you're able to say reduced hospital nights, gosh, that's a saving. What about the less measurable things, like, for example, the impact on quality of life and well-being of not being in hospital for those extra 90 nights? How do you measure that?
Exactly. So in that case, we measured a whole bunch of things, including reductions in addiction, reductions in family violence, improvements in people's sense of subjective mental health. So we're looking at things like income impacts, of course, government costs, but also some valuation of subjective changes to people's well-being, which is often, to be honest, what's most important.
Okay. I want to talk to the sense we're getting in the sector that Impact Lab is a kind of kingmaker for funding now. Do you see yourselves, how many reports have you done? How many? Over 200, right?
Yeah, coming up to 300.
Coming up to 300.
Yeah.
Do you see that as kind of king-making? And do you think people are more likely to get funding as a result of having an Impact Lab report?
So I think what we see ourselves as doing is trying to help provide a better information flow to the sector. So if you take government, for example, often the most information they get about what community organisations are doing is through their contract reporting. And there's a couple of real issues with that. The first one is it's very siloed. So if it's education contract, it's school attendance, but actually a charity might need to be addressing housing, healthcare, food in order to achieve better school attendance. But none of that's captured in the contract. And it's also very much driven by the funder, and every funder is different, and charities spend a lot of time chopping and changing how they report to what it is that each funder cares about. So in our reporting, what we're trying to do is give charities a chance to show a more holistic story of how they're making impact across time, across different domains of people's lives, and also, the story that they see as the real story of change rather than just what a contract says they should care about.
I'm writing down the word holistic because I want to pick up on that.
Yeah.
So the holistic story as determined by who? As determined by Impact Lab, presumably. Let's come back to the question, and the question is there now a custodian role, a kingmaker role? Is Impact Lab essentially providing a template which would be skewed through the worldview of Impact Lab, right? In other words, are you kind of, to use a Chomsky-esque term, manufacturing a form of consent around who gets funded, why, how they should behave?
I think we see the information as a tool. We have no influence over what decision makers do with that tool, but I happen to really believe at a pretty fundamental that information is critical. And the reason I believe that is my first job out of university was I was seconded to a remote Indigenous community in Australia. And when I got picked up at the airport, the lady who picked me up said, "It's pretty embarrassing, but in our town, the flashiest building is the courthouse." And she was bang on. So the courthouse cost $40 million, and there was a lot of Indigenous kids in the juvenile justice system there. At the same time, there was $0 spent on alternative education for the kids who were not engaged in high school. So what I kind of realised from that is there is a big disconnect between the investment decisions that we're making and what's actually happening on the ground and what it is that is really going to create change for families. And so we need some information to help us address that about where investment's going and what long-term difference we can have confidence that it's making.
And of course, information is key, but so is money, right? And
Yeah.
boy, it's tight out there now, isn't it?
Yeah,
I mean, the OT funding providers having contracts cancelled or reduced earlier in the year. Is there a critical shortage of money? Is there too little money in the sector?
Yeah, I think there's a real constraint around funding, and certainly in some areas, absolutely. Like providers are seeing need.
Give me an example of an area where you think there is an absolute shortage of funding.
So I was talking to a woman in Hamilton 2 weeks ago who said that there are 60 kids there who are not in any form of schooling, but they're also not in alternative education because there's not funding for those placements. So she's got rangatahi turning up to her service who want to be engaged, right? Who want to be involved, that she can't support because she doesn't have the funding to do so. So I think the funding constraint is very real, and how we're seeing that charities are responding to that is firstly trying to diversify their funding sources so they're not dependent on one source. That's really important. And then I think the second thing is they're working hard to prioritise because the need's not getting smaller. So where do they prioritise their focus? And the charities that are coming to us, they want to prioritise focus not based on kind of what's convenient or what's easy, but actually what's going to create the biggest long-term impact. So for example, we worked with a disability organisation recently who went through the Good Measure process, and they realised from it that the greatest need for their services in rural areas for young people with disabilities, but their service is mainly focused in urban centres. So they've made the decision to actually prioritise going to the place that's harder and more costly because that's actually where the barriers are greatest to young people achieving their goals, and that's what they want to do because that's their mission.
You talk about good measure. How often do you look at a charity or a provider or somebody doing work that is ostensibly good and think yourselves, oh, wow, you're falling well short of what you ought to be delivering? And what do you do in that situation?
So it's actually pretty rare. I think the organisations that come to us tend to be ones who really believe that they are making a difference. And we find that almost inevitably they're doing some good, and often really like amazing good.
What's amazing good look like?
So I think like there's so many different versions of it, but we're seeing some themes, especially for providers working with the New Zealanders with the most complex lives, because 15% of New Zealanders roughly face really significant barriers to living the lives that they choose. And what we see is that mainstream government services like schools and hospitals that work well for most people often don't work as well for people with really complex and diverse needs. So what good looks like is often community organisations responding to that need in a way that's based on trust and really building deep trust with people, because if you don't have trust, you can't help. It's about respecting people's autonomy, so treating people like they have agency and choice, and being flexible, because if someone has 8 or 9 things going on in their life, you need to be flexible to meet the need of what is their priority on the day. And then the third thing I think is paying attention to the context of the family and relational situation people are in. I remember talking to a Pacific nurse who said, I can be treating someone for diabetes, but I might not have the actual decision maker about that patient's health in the room. I've got to get them in the room. So those are some of the things we're seeing that.
Can we drill into an example? So this is I Am Hope Gumboot Friday, right? So this is the impact they're reporting on them. It says social return on investment, $5.70 for every $1. Right. So then, lo and behold, Gumboot Friday gets $24 million boost from the government out of the blue with a reasonable degree of bewilderment from the sector, the mental health sector. And the Minister, Matt Ducey, cites research has found that every $1 invested in I Am Hope results in a social return to New Zealand of $5.70. So he's directly citing that from your report, isn't he? Where did you get that figure of $5.70 from?
So we go through a process. First of all, we sit down with the people who are running the service frontline to really understand what are they seeking to achieve for whom, and what are the kinds of changes that they see happen for people on the ground that they work with. We then look at their frontline data. So that can be data about how many people they're reaching, how much are people engaging.
Their frontline data?
Yes.
To what extent do you rigorously audit that, or do you just receive it and accept it?
So it's a bit of a balance. So we work through a process to help charities understand some important concepts like meaningful engagement. Like, what does it mean for someone to meaningfully engage with your service? What do you understand about the kind of the story that has brought people to your service? And then we'll look at that data, and because we've looked at 300 other programs, we can calibrate a bit if things look a bit off or if things don't add up. And then we kind of do a logic map of how do we think impact happens here, and what does the government data and the academic evidence show us to help us build confidence that change is occurring.
Can I push it on the dollar term then? Where does the $5.70 social return on investment come from in I Am Hope Gumboot Friday? But anywhere, but let's use a specific example.
Yeah, so I mean, I don't talk to the specifics of models of charities without them in the room or without their explicit permission, because the trust of the organisations we work with is really important to us.
But is that their figure or your figure, $5.70?
So it's our figure. So we're an independent methodology. And so we get the data from the charity, we combine that with other data, and we put it through a pretty demanding and consistent SROI process.
And do you consider, so opportunity cost, opportunity loss, do you consider what other people in that space might be doing? Although it wasn't you, obviously, who gave I Am Hope Gumboot Friday $24 million, it was the government. But it seems pretty clear that they were very impressed by your Impact Lab report.
So we look at the academic evidence, and that's a really interesting process, because as you can imagine, sometimes there's a whole lot of evidence and it's fairly consistent and there's a lot of agreement among experts. Other times there's just no evidence, or there's a lot of disagreement, or you get lots of different kinds of results. So we can work with what we have. Our goal is to work with the best information that's available. And a really important part of the process is identifying where do we need to know more. So just to give you an example, we worked with an iwi-based healthcare provider recently, where their data showed that they had a lot of people enrolled in the program who weren't actually accessing any healthcare services. So they looked at that data and they decided to call up all the people who were enrolled but not accessing services. And what they learnt was, particularly the older men, often didn't know how to use the app that you needed to use to access the services. And so now they're addressing that and making it easier.
How do we get this right? How do we make sure that, boy, I was going to use the term bang for our buck, it's a revolting term, isn't it? But when money is really short, and there is so much pressure on providers to do more with less. And funders are squeezed and the government's saying, you know, we believe in a form of devolution, so off you go and do this kind of stuff yourself. How the hell do we get it right?
Yeah.
How do we achieve... And, you know, I've got in here your Charitable Sector Insights, which is a fascinating read. And in it you talk about investment choice number one, focus versus reach, right? You can reach a whole lot of people but do bugger all. You can reach a small number of people and be really intensive. How the hell do we work out what the balancing act is?
Yeah, well, I think that has to be done in context. So a big part of it is putting information, particularly in front of the people who are leading these community organisations, who are doing the hard work in their communities. And then they can look at the full picture of the context that they're in to then make decisions which hopefully are a bit more informed than the ones they were making yesterday.
Are we getting it right?
In terms of?
Just taking care of people. And I'm not having a conversation with you about the government because you're not part of the government. But the more the sector takes care of people, the more the government can kind of sneak out the back door and recuse themselves, right? Are we getting it right as a country?
Yeah, I think there are hundreds of organisations around Aotearoa who are getting it right. And what they need, I think, is just some tools to help them tell that story and really demonstrate the impact that they're having long term. And then also to be able to build a bit of funding sustainability to then be able to make the decisions about how to grow, improve, enhance what they're doing.
Do you get feedback? So if you say to people, if you do an Impact Lab report and you say, let's use the example of the app that the elderly men weren't able to use, do people come back to you and say that has made a demonstrable difference? That we are working better, connecting more successfully, being more transformative? Do you get that feedback?
Yeah, so we've had probably about half the organisations we work with make some kind of meaningful improvement to their service, and about 3/4 make some meaningful improvement to their data system so that every day they have better visibility of how to deliver their service. So we had one recently, it was a child therapy charity. And when they went through the data process, they realised actually a lot of the kids we work with are neurodiverse. And we never really kind of realised that because the contract didn't ask about that. So they realised that their staff weren't actually trained to best support these kids. So they were able to make the case and put in place a training program so that their staff were better equipped to help kids as the best way possible. And that's a pretty typical kind of example. It's really specific to each charity, really specific. We don't tell them how to improve. We just give them a process that helps them take a really good look at what they're doing and take a step out of the business as usual, which is really hard to do when you're on the front line and you're taking calls at all hours of the day and night. And that's really what we're seeking to provide, an independent third-party process that helps organisations see where they can do better.
Maria English from Impact Lab, we really appreciate you joining us this morning. Thank you so much for coming in, Maria. It's lovely to have you here.
Thank you.